Hi, my name is Rebecca. We're going to be performing an IV push today. We're going to go ahead. My medication is desmopressin. I'm going to give 4 micrograms per milliliter of it. So upon walking into the room, I'm going to perform hand hygiene, and I'm going to check the patient. I'm going to ask 2 forms of identifiers. I'm going to make sure that the IV site is good, that his wristband is intact, and that it says the correct information. I'm going to check vitals, make sure they're okay before I administer. And I'm going to gather my equipment, which is my medication, my saline flush, and then my alcohol pad, and also clean gloves. I'm going to go ahead and check the IV site for any complications, any swelling, redness, edema, any secretions. So I'm going to go ahead, explain the procedure to the patient. I'm going to perform hand hygiene once more. Before I put my clean gloves on, I actually start the IV push. And I would have checked my medication against the MAR. I would have checked it in my drug book, make sure that all the dosages were correct, that the rate was correct, that it's the right medication. All right, so now I can go ahead and put my clean gloves on. All right, so now I'm going to go ahead. I'm going to have my saline and my medication both primed so that there's no air bubbles. I'm going to clamp and swab for 15 seconds, and this is to maintain sterility. And first I'm going to flush, I'm going to aspirate, check for a blood return, and then I'm going to flush down 2 milliliters. I'm going to pop my cap off, flush down aspirate, flush 2 milliliters, and we're all done with that. So then I can go ahead, I'm going to clean my port once again. My tubing is still clamped. Clean my port for 15 seconds, and I'm going to administer the medication. Alright, so now I can do my medication. I'm taking my cap off. I'm going to administer, and I'm going to start now. I would administer 1 milliliter, which is going to contain 4 micrograms into it. That's going to take 60 seconds, and that actually happens to be my dosage, so I'm going to push my medication for 60 seconds because I'm pushing in 1 milliliter. So I got one of the quicker medications, but alright, so when my time is up, I can start cleaning the port again. This is going to go in the biohazard. I'm going to throw it away. I'm going to clean my port with a new alcohol swab again for 15 seconds. And that's just any possible chance of contamination. And then I can administer my final saline flush. And it's going to be 2 minutes. I'm going to push 2 milliliters. I'm starting now. And while I'm doing this, my tubing is still clamped. I can talk to the patient. I can ask him if he's feeling anything abnormal. I can also explain the side effects while I'm doing this. So any side effects could include dizziness. They can you can have the big one with seizures, and that was the big red one that you don't really ever want. So you can have drowsiness, you can have vulva pain, you can have abdominal cramping, you can have headaches possibly, water intoxication was one of them. You'll also be feeling drowsy too was one of the side effects. And I would instruct him if he had any of those side effects to come immediately and use his call light and tell one of the nurses on his team. Then one of us could come and rectify the situation if necessary. And you had wanted to administer it at the same rate. Since I'm flushing 2 milliliters, to clear up the line, it's going to take 2 minutes because that's what my rate for my medication was. Alrighty, we can take our saline flush off. We are all done, so I can throw away any trash that I had. For hand hygiene, I'm going to assess the patient, make sure that he has his safety, bed rails up, bed down, bed is locked. I'm going to make sure that he has his call light, that he knows how to use it. I'm going to also document, make sure all of his personal items are in reach, change my curtain, shut it again, open it again, whatever you want. And I'm going to check my vitals, make sure everything's okay. I'm going to, once again, instruct him of the side effects, and before I leave, I'm going to hand hygiene and leave the room, and I'm going to have documented the time, route, medication, how he tolerated it, and then we are done. I'll be back to check on him in an hour or 2 hours, depending on the situation.